Aspen collars come in a bag like so. When you open the bag, inside will be spare pieces, the back panel and the front panel. The pads are removable on the front of the collar. They're removed with Velcro like this. And then replaced with the green side out like this. There's an additional back piece for patients who will be wearing the collars longer term and are not able to mobilise. This also comes apart for the foams to be washed. The back of the head velcros off, and to remove the other piece, pull the velcro through the slots. The foam comes off and the plastic comes apart. In order to replace, slot the plastic back together and replace the foam. And pull the Velcro back through the slots. And replace the headpiece.
To apply the collar in the supine position, follow these 6 simple steps. Separate the collar by removing the Velcro straps on the back panel from the front of the collar and pre-form by bending or rolling the collar ends in towards the centre of the collar. This will help ensure that the collar conforms to the patient's anatomy, making it more comfortable and providing adequate motion restriction. One person stands at the head end of the bed, performing a head hold to maintain a neutral alignment of the cervical spine until the collar has been fully fitted. The second person positions the back panel next to the patient's head between the patient's earlobes and trapezius muscle upper shoulder. The Velcro strap should read Vista the right side up to the person fitting the collar. Place your hand on the back panel and simultaneously press down to compress the bedding and slide the back panel behind the patient's neck until the back panel is positioned correctly. The back panel should be centred behind the patient's neck. The Velcro strap should be pulled out to the sides and aligned at midpoint between the bottom of the patient's earlobe and the top of the trapezius muscle. The patient should also be encouraged not to move their head and to lie still. Pull the side panels apart to open up the collar and then position the collar so that the collar is lying flush under the tip of the patient's chin. The sternal notch should be visible within the access window. Allow the collar to rest, then slide the sides of the collar up and over the trapezius muscle. Then hold the front section of the collar firmly in place with one hand, and with the other hand push the sides of the front panel up over the shoulder muscles and around the neck towards the ears. Whilst holding the front panel with one hand, pull the Velcro straps out and forwards to attach them to the front collar. Ensure that the patient's chin is centred on the chin piece and aligned with the dial and sternal notch. Whilst holding the front panel in place, grasp the dial between your thumb and forefinger and gently pull the dial out to release the lock. Maintain that pull on the dial to turn the dial either clockwise to dial up and raise the front section chin piece of the collar, or anti-clockwise to dial down and lower the front section chin piece of the collar. Dial up until the foam pad on the chin piece begins to compress. This indicates that the correct height has been achieved. Check the green sizing indicator on the side of the front section of the collar to ensure that the collar is aligned in the indicator window. Release the dial and then it will automatically lock. To make sure the collar is locked into place, twist the dial without pulling to confirm it's in the lock position. It is important that the collar is properly sized to provide adequate motion restriction. Ensure there is not a gap between the patient's chin and the chin piece. To tighten the collar, place one hand on the front of the collar and attach the Velcro straps one side at a time with the other hand. To reposition, anchor your fingers on the inside of the collar, form each side panel around the patient's neck by pushing inward on the back edge whilst pulling the Velcro straps out, then forwards to attach to the front panel. This will enable the collar to conform to the patient's neck shape. Make sure that the side does not get caught in the back panel window and that the front and back panels overlap each other, as this can prevent a good fit from being achieved. Tighten the other side equally and repeat as needed to ensure a snug, symmetrical fit. On visual examination, the collar should be checked from a front and side view. The chin should be centered comfortably on the chin piece. Their nose and chin should be aligned vertically through the center of the collar at the front. The head should be in neutral alignment, not overextended. Sides of the back piece should overlap sides of the front piece. The Velcro strap should be aligned symmetrically so that each side is the same. Sternal notch is visible, and both the front and back panels are central. Chin, dial and sternal notch are all in alignment. The large openings in the front piece and the back piece should be centered over the neck. The collar should be flush with the skin. There should be no slack or gaps in the collar. To check this, push your finger down past the ear behind the mandible. Run your finger along the collar towards the chin and then underneath the sternal aspect of the collar. The chin should be flush with the end, and the chin pad should sit under the chin, not sticking out. No plastic parts of the collar ought to be in contact with the skin. Check the back of the chin piece is not pressing against the patient's throat and that they can breathe and swallow comfortably. With a patient in supine position, position the back panel behind the patient. Preform the front panel of the collar and position it under the patient's chin. Dial the height of the collar until the patient's chin compresses on the chin pad. Attach and tighten the Velcro on each side of the collar. Pivot each side of the collar off the trapezius to support the chin and achieve a proper fit. Check the airway is clear and that the patient can swallow. Check no plastic is touching the patient's skin and that no hair is in the collar, and ensure the collar is a snug fit.
Fitting an Aspen collar with the extended back piece in situ follows the same procedure as previously described. Make sure the extended pad is behind the patient's head as shown.